hospital about 6 months ago, and we've been using it for urology, colorectal surgery, general surgery. We found it to be safe. And so why we're using these different systems? Because as new systems come into play, the cost of these operations, procedures, technology becomes cheaper, and that way we can get advanced treatments using advanced technology to our patients at a lower cost, but at achieving better outcomes. And I think that's why it's important for our hospital system to drive technology and get these programs up and running well ahead of the competition. So in colorectal surgery, robotics is particularly useful for cancer surgery, in particular rectal cancer surgery. It gives us more precision, there is less blood loss, less pain, quicker recovery, better preservation of function. It's not enough if we just cut out the cancers, but it's important to preserve function so that patients can get back into normal function. Importantly, research has shown that with robotic surgery, when you do for rectal cancer, your sexual function, urinary function, continence, everything is improved. So we often see young patients who have these cancers, and if you're just going to get cancers out and not concentrate on function, they may end up with poor function all their life. So it's very important to achieve all those functions with this technology. And what we've done is, because of the high volume and specialization, we built a team which does this routinely. We are able to bring the cost down very similar to laparoscopic surgery. And this has been shown around the world. If you have a high volume, highly specialized center, you can bring the cost down to similar to laparoscopy. Also, we've developed multidisciplinary teams. So what are the results we've achieved is audited so that the best results are achieved for our patients. The decision for a particular treatment, whether it's open surgery or robotic surgery, is made by a joint group of doctors so that the best plan is made for the patient, and this is discussed weekly, and this improves the quality, what we want to achieve at the main hospital and across Chennai. So, looking at our own unit, we started this unit in 2016. It is one of the only subspecialist colorectal unit in our state, in the corporate sector. We've developed a team. We perform more than 750 colorectal procedures a year, and at least 150 robotic procedures in a year. We are a big program. We're the only unit to use both different robotic systems and develop the cost-effective robotic surgery model. This is a quick slide, busy slide too, but basically what the slide says, our outcomes are comparable to what's achieved anywhere in the world in both colon and rectal cancer surgery. And we do the quality assurance audits every week. And we've developed collaborations, and this is very important because these collaborations are not only across the world with Cleveland Clinic and UCL, also locally. So as you have seen in the newspapers, the Omandar Hospital had their new robot installed. Their surgeons came to our unit to learn how to use a robot. And so we are ahead by about 5 to 6 years in this space already. And we're starting to use new robotic systems so that when they get to use it, we'll be able to mentor them as we got mentored by our friends across in the Cleveland Clinic. So there is a lot of collaboration going on and driven by our chairman and our mentors from across the world. This is a summary of what we've been doing from 2012, 16 and 21 where we are now. And so where we're going forward, what are we going to do? We're going to create more awareness. I think that's what's important. If we create more awareness, patients will seek us out when their diseases are in a much more easier or simpler problem, so they can achieve better outcomes. We are going to concentrate on our screening programs so that we can pick up these problems earlier. We're going to scale up our robotic colorectal surgery program. We already had several of these programs running in Hyderabad, Bangalore, Delhi, Mumbai and Calcutta. So we are scaling up mentoring these units so that they increase the volume, decrease their costs and achieve our standardized outcomes. We're extending our Chennai program across to the Proton Cancer Center, starting subspecialized organ-specific rectal cancer program, and there's also hepatability programs, and that's all in the pipeline. And we're also achieving more reconstructive procedures, and we want to do less and less end stoma permanent bags so that our patients have a better quality of life. And the exciting thing, what we're building for the future is remote surgery, which is using the robotic technology. Because now we have a robot which is controlled by a console in the same room, and it's connected by a wire. In 5 to 10 years' time, that wire will go and will be connected by 5G networks and 6G networks. And all our robots across the country will be connected together. So patients, for example, in, say, Puri, in Orissa, don't need to come to Chennai to get quality care, or a specialized robotic urology surgeon or rectal cancer surgeon. They can go to Bhubaneswar. They might have local expertise. If not, we can connect using our robot to their robot and operate from here. So that one technology is available to accessing specialized care is easier, specialized surgeons is easier, and with their families across. So that is where we are as our next phase on development. So with that, I would like to invite Mrs. Preeta Reddy, Vice Chairperson, Apollo Hospitals Group.
Krishnan, it's a pleasure to be here. And sometimes I wonder, it looks like we've got every month a date with the members of the press and media in this hall at Taj. And it seems to be happening more often. The good thing about it happening more often is the fact that, we as a team at the Apollo Hospitals Group are consistently trying to see how can we raise the bar on the way healthcare is being delivered in our country, for the neighboring countries, and for the world at large. And I think one such great performance has been from Dr. Venkat Krishnan, his team at the Apollo Hospitals, because this is now the busy path-breaking. It's a great achievement, and Chennai has developed a very strong cardiac robotic program also. So I think the robotic work has come to stay. And for us, why do we want to communicate? Why do we need to communicate to the public at large? Is because we are seeing an alarming rise in young adults having colorectal cancer. So for them, early screening awareness is very important, because when caught early, when it is tackled robotically, the outcomes are phenomenal. They can get back to absolutely normal lifestyle. The recovery is phenomenal, and literally they can be treated and they can forget about the fact that they even had cancer. So I think it's a responsibility for all of us to go back and tell the public that, please be aware, please get screened, and in the event of you needing intervention, this is the best way to do it. So I think from an awareness perspective, it is phenomenal. As Indians, we have to be proud that, we bring the best-in-class programs to our country and to our countrymen. And our collaboration with the University College of London and the Cleveland Clinic ensures that the medical team is always up to date on the latest developments available for the benefit of the patients. And I think that is really important. Also, the center offers robotic and laparoscopic colorectal surgery, which is there, but it also does cutting-edge treatments in proctology and the pelvic floor diseases. So, you can't just treat something and leave it alone. Work has to be focused and it has to be comprehensive. And we are probably the only hospital system which are treating specific areas and developing specialists in that area. So gone are the days when a general surgeon would do everything, and you saw that in the slide which doctor put up. And now if we're saying we're doing colorectal, then that team, that surgeon will do only that. If we say we are doing something in the area of stomach and GI cancer, then that surgeon will do only that. If it's breast surgery, it's only that. Thoracic, it's become specialized, because the more you do in each area, the more you specialize in each area, you become good at what you do. And you all know that practice makes perfect. And because of that, we are so proud of the achievement of being able to do 500 surgeries. Because once you cross that number of 100, 200, you really become an expert in that field. And I think people need to know that the expertise is available. It's still disappointing on two sides that young adults don't even think about having these options or going for screening. People who can really go abroad, they still think they have to go abroad for this kind of work, while the best center is actually in our own country. So I think from that perspective, we really need to talk about it and to focus about it. Where again, and I'm really proud of the team, is that we're the only center which has different robots. We're encouraging different areas of robotics. So we're the largest busiest robotic program in the country, because we do robotic work for colorectal, like we're talking today. I've told you we do cardiac and thoracic. We do the orthopedic and spine work. So when you bring all this together, I think it's a huge number and it's a huge volume. But having said that, for one surgical team to work on two robots, they're working on the Da Vinci, which you saw. They're working on the Hugo, the Medtronics. But what excites me for the future is that they're Indian robots developing, Indians. So when we talk about Atmanirbhar, here we're talking about it in two different ways. We're talking about us being Indians and, people from the rest of the world coming to India for procedures, Indians not going abroad for healthcare from both fronts. And then we're talking about high-end robotics being manufactured in India, and that is going to happen very soon. And when that happens, we again will have the Indian-made, the Made in India robot with us, which again will be part of the whole armamentarium. So we will have, from a learning perspective, from a research perspective, and the fact that we're doing cutting-edge work, I think the Apollo Hospital's team promises once more to be the best in class to do it. So while we're saying that, I know that, it's always a worry on cost, because wherever I go, whether in any government organization or when I talk to people, it's like, how can we make healthcare more affordable for our countrymen? And I think while we're straddling high-end procedures, we should always remember that when a procedure like this is done here, and with the fact that we're able to be innovative on our usage of the machine, on the time, on the way it's done, it makes it so much more affordable. And the fact is that we've worked with insurance, so we need not feel that somebody cannot access robotic surgeries. And I want to mention that anybody with a good insurance scheme can have access to a robotic program. So I think overall, a lot of work has been done by the clinical team and by the management team to see that every Indian has access to this kind of work. And I think that's what really makes me proud, because Chairman set out on a journey saying that, India will have the best of care available anywhere in the world within our country for people at large. And consistently over 39 years of work, we have consistently done that, because we have a large pool of talent, both the managerial talent and the clinical talent, just being part of the vision which Chairman set out. So I'd like to then say that the media has also been with us over the past 39, 40 years, because so you are also part of this vision, part of this dream, and thank you all for being with us on this journey of 39 very successful, very fruitful, very rewarding times for the benefit of mankind. Thank you, and Jai Hind.